What did you last say, Charity? No?
Can you hear me?
Yeah, I thought you said something to us, but no.
Welcome to today's Power of Knowing webinar, Protecting Mental Health and Preventing Suicide, How Awareness, Early Action, and Support Save Lives. Understanding comes from knowing. Mental health challenges affect people from all walks of life.
Charity, we just lost your microphone. Welcome to today's Power of Knowing webinar, Protecting Mental Health and Preventing Suicide, How Awareness, Early Action, and Support Saves Lives. Understanding comes from knowing. Mental health challenges affect people from all walks of life, but stigma, silence, and lack of knowledge can often prevent individuals from getting help that is needed. For veterans, the impact of trauma and transition can create additional barriers to care. In this important webinar, we'll explore how understanding the signs of mental distress, applying mental health first aid principles, and offering early support can reduce suffering and help prevent suicide. You'll learn practical steps to support your mental wellness and the well-being of others, including those who have served. The Power of Knowing is a free webinar series created by AuthoriCare Collective, a nonprofit organization that empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome our moderator, Risa Hanau. Risa serves as clinical and community educator at AuthoriCare Collective and is also a member of the Cone Health Ethics Committee. She's a licensed clinical social worker. Risa, I turn it over to you.
Thank you, Paul. It is my pleasure to introduce our panelists for today's webinar. Dr. Caitlin Boger. At AuthoriCare Collective, Dr. Boger is the Director of Counseling and Behavioral Health, which provides services for adults, teens, and children. Caitlin is a certified dialectical behavioral therapist with over 12 years of experience and has over 10 years of crisis experience assisting individuals who may be experiencing suicidal or homicidal plans or thoughts. And Rita Honeycutt. Rita is a veteran service officer for Randolph County Veteran Services, as well as a mental health first aid instructor. Rita is currently a student of the Shackelford Leadership Institute. She is a published author and is currently working on her second book. Thank you for both being with us, leading this important conversation. We know that this can be a difficult conversation and an important one. So I want to thank the participants joining us. We want to learn a little bit about who is joining us. So we have a polling question. It is multiple choice. Will come up on your screen. And if you can choose all that apply to you, we know that we have mental health advocates, we have caregivers, we have veterans, we have veteran family and friend. So go ahead and check all that apply to you, and that will give us a good idea of who is joining us for our conversation today. See lots of people doing that, and I appreciate it. Many advocates, many caregivers. Over 20% of people identify as a veteran family or friend. a number of human service professionals, healthcare professionals, volunteers. We have a wonderful mix of people joining us for our conversation, and thank you for participating as we begin our conversation. I want to also take a moment to note that September is Suicide Prevention Month. And so shining a light on this topic is certainly something that we want to do. We know that as we look across our community, whether we ourselves are veterans, friends, family of veterans, and also working in the healthcare community or other service organizations, and also caregivers. We know that mental health struggles cut across all populations, and we want to have a conversation, open conversation about that today. I invite everyone to make use of the Q&A box, and any questions you have, thoughts that you want to share with us, please submit those. We will try to answer as many as we can during our time together. Also know that we will be making mention of different resources. Those of you who are registered tomorrow will be getting an email, not only with access to the recording, but also links to the resources that we mention. So in addition, if you have a question that is not answered, just respond to that email, and I will reach out to Rita or Caitlin, and we will get you an answer. So I think with that, to begin our conversation, Rita, we know we are talking about the entire community, and we also know that we're also thinking about our veteran community. And can you tell us about your role as a veteran, a vet service officer, through the lens of mental health, and when somebody reaches out to you and has contact with you, and who is reaching out to you?
Yeah, so a veteran service officer is basically the person who navigates the VA for our veterans, veteran spouses, and veteran dependent children. So anything that the veteran needs when it comes to understanding the federal government and what they have benefits to, that is our job. When they're reaching out to us, it's because something happened in service and they need supportive care for that item. So the large scope of our job is getting them in touch with benefits like compensation, education, housing, but a small snippet of our job that in this office we've tried to make bigger, because we have all been there as veterans in this field as well, is the getting them the healthcare and the mental health care support that they need. A lot of times when veterans are coming to us, it's the first time they're telling somebody their in-service story. And so I'm also a peer support specialist. I'm hopefully going to get my doctorate done in the next 2 years. But we all have gone through some kind of training so that we can support them when they're telling their story, because a lot of times they don't want to tell their family, this.
I think that Rita is frozen.
Looks like it.
There you are.
He's
You're back, Rita.
Okay. A lot of times let me try this. I went into the quiet room, and as soon as you shut the doors, the internet's not as great.
That sounds right.
So a lot of times when veterans come to us, like I said, it's the first time they're telling their story to someone. And unfortunately, veterans have had this stigma of mental health against them a lot of times that they've been in service, because if you go and you ask for help, is it going to compromise my job? Is it going to compromise my clearance? So they're often afraid to. So when they come to us, sometimes it's the first time they're talking to somebody, and they're more apt to talk in a veteran to veteran environment. So we really try and give them the opportunity to open up and encourage them. Okay, based on what you've told me, go and talk to the vet center or the VA, or maybe we're just going to have these conversations in office based on our abilities and what you've told me. And that's why it's been so important for us to really push mental health first aid as an instructor, because we want to teach the people around the veteran how to also support them.
And I love that. And I know we're going to talk about that mental health first aid. And you said a number of things. And my takeaway is that you are often the first stop and you are really tuning into what people are saying, how they're saying it. And you are thinking about what resources, what services, what connections you might make for this veteran or the veteran's family, correct? So Caitlin, if we sort of expand that lens, we know that you're having first contacts, a lot of professionals are, and that assessment, or when we think about what is it that you are listening for, you are observing, that may make you feel like there is a concern in terms of mental health, or what cues are you really paying attention to?
Yeah, so I would say in particular with veterans and of course others, but people that have experienced something, that there are a lot of signs or symptoms that there could be a concern for suicide or even just mental health in general. Feeling like they're a burden. I think a lot of times when people start to feel like other people are helping them too much or they're not doing something for others, people in general are helpers, especially service members. They're really in that helper mode sometimes when they get out of the service or while they're still in and they're feeling like a burden and not feeling helpful. That can be a big sign to those of us that help, or even family, friends, that there is a concern here, because it's unlikely, right? It's not likely. That's the bad talk that you're a burden to someone. But that's when we see that spiral, I think, is that feeling hopeless or trapped, like feeling like nothing is going to change. It's always going to be like this. Withdrawing from people, especially people that you were close to. I think there's a really big difference between introverted, I get my energy from being by myself, and withdrawing, like social isolation. So those are two big things, especially if you see social isolation from a super extrovert, that would be concerning. But then if you're seeing introvert completely withdrawing, not doing things they liked to do, activities that they enjoyed, that would concern me too. An increase in substance use or a use of substances, especially like illegal substances. Sometimes with service members, they can have chronic pain or issues from serving. Sometimes those can lead to feelings of depression, because if you're physically unable, or anxiety, or many things, if you're physically unable to do the things you used to do, and we see that a lot with veterans that have been deemed disabled to serve, that's a big change in life activity. And I think that would be a normal reaction to an abnormal situation, but that can lead to a lot of mental health concerns, because if you're used to going out and running around all day and helping people, and now you're confined to your home or confined to an office spot, I think most of us, when we think military, we have a picture in our head of what that service is like. And if you can't do that anymore, that can really change your outlook and your life view of who you are and what you do. And I think the big thing about being a military member is that's your life. You're out, you're there, you're doing it. And even getting out of the military is a major life change. I would say change in sleep, like your sleep habits changing, not sleeping, sleeping too much, reckless, risky kind of behaviors. So if you're the kind of person who normally would take care of yourself and then you get a motorcycle and you're riding all around town without a helmet on, that would concern me. And then, of course, some big, especially suicide ones, are preoccupation with death, saying you want to die, or even giving away items that are meaningful. Those would all be concerning to me.
So I know that we are thinking about our veterans, but I'm also thinking about at AuthoriCare Collective, we are really working with a number of people who are dealing with a serious health challenge. We're dealing with many who are caregivers for somebody with a serious health challenge. People who have had deaths in their life. You know, they've had somebody they love was ill, and so I'm thinking about the things that you just described, and then applying them to our general community as well. I'm guessing that the things that you've named are things that I want to be attentive to for anybody that I might be coming into contact with.
Right. And I think what Rita and I are trying to say is yes, there's professionals like Rita and I. I mean, she's a trained peer support specialist, which means she has lived experience with what you're experiencing, which is amazing because who would understand that better than someone who has been through what you've been through, right? That's exactly what you want. And then myself, I'm a licensed mental health therapist. So different worlds in some way, but the same, right? But anybody can notice that someone is having a hard time, and anyone, like you said, can say, hey, I have this little thing where, it's like, hey, I've noticed this behavior. Can I help you? What's going on? The worst thing that someone's going to say is no thanks, or oh, you've noticed that, but actually this is going on. It's a really not dangerous way, as a person to call out, I'm concerned. Are you okay? Because that happens a lot in life where you see somebody and the question is, this is different for you because we see it. We try to move along because we think people don't want to hear it, but actually people do want to know you are concerned about them.
I think that's interesting because I think many people are afraid if I bring up something I'm noticing, I may offend the person. Or if we're talking about suicide, I might prompt them to do something. And really that just is not the case, correct?
Right. Yeah, and I think suicide is very similar to when you have a person who died. So if you can get in that mind space of thinking about when you experienced a death of a loved one, you're thinking about them. They're on your head all the time. When you are thinking about dying, when you are thinking about killing yourself, it's in there. Someone else saying it to you doesn't make it pop up to the surface. It's there. It's just like when you've experienced a death, someone talking about the death you experienced or saying your father's name or your sister's name or your son's name, it was already there. It's already in your head. It's just nice that someone cares enough to ask you if you're okay. Yeah, I think that's a big myth that we have going on where we think, oh gosh, if I bring up they might want to die, what do I do if they say they do want to die? Which is scary, and I get that, but it's there. That thought is there if it's there. And the worst thing they can say is, oh no, I'm just having a really bad day.
And so what we want to do is try to empower all of us to know what to do. And so Rita, I'm thinking about when I'm wondering, you get calls from veterans, but I'm guessing you get calls from family members of veterans, and there are services to help them in addition to the veteran. And so tell us about some of the things that you do or where you can guide people and some of those resources.
Yeah, so there's actually a lot more out there than there used to be, which is nice. Being a veteran and a short time veteran spouse, it was trying to navigate both worlds. And so I love that things like the vet center exist, because they will help out spouses and children as well. The VA has started expanding programs that they also will do marriage counseling now. So if you want to go with your spouse, like you have that option. There's more and more programs that are coming out, and the VA will refer to community care when they don't have that program, which is really, really nice. And there's more people out there that are offering these services for veterans. I know just here in town, we have the place called Bloom, and they specialize in.
Somebody might have shut her door again.
Yeah, we might be having some more internet issues.
Oh, that's what it was.
As soon as I open that door. So it's nice. Can you hear me now?
Yes.
Okay. It says I'm unstable. I'm not. So it's nice that there's these small places that are starting to pop up that will give that support to our veterans. So they're everywhere. It's just trying to track them down. And so that's why it's nice to hit your up to your VSO office, because they might know where those places are, because that's our job, is to connect them. So I can tell you where several are in Randolph County, a few in Guilford, but that's where it's nice when you connect with that office, they are going to have those resources for you, because there is a lot of support out there.
And we can be looking across North Carolina and even out of North Carolina. And one of the things I think that you've brought forward is the early connection, the early intervention that, certainly we want to help somebody that might be in a crisis. But if going to marriage counseling or going to the vet center for social interaction, or connecting with somebody that I can tell my story to, that sounds like our, making an early identification of a need and building up the supports that has to help decrease the likelihood of us getting to a crisis point. Plus, we're already connected.
And that's the nice thing about like some of these other organizations too, like the American Legion, they have the spot for your veterans, but they also have an auxiliary for spouses. And then they have the sons and daughters of the Legion. And so it's also that ability to bring your kids in. And so the whole family has this network system. And there's other organizations that do that too. The AMVETS, DAV, all of those different places have that support connection. And just having sometimes somebody to talk to, even if it's not mental health related, somebody that you can go, oh, let's get the kids together for a play date. That can be huge for some people. I know just within our family, when we partnered with a group that works with other veterans and veteran spouses, like all of our kids get together. My daughter is the oldest, but now she has all these like 12, 13, 14-year-old kids that are looking up to her. And so she's kind of taken them under a new wing and giving them a new level of support. And it's not even mental health support. It's, oh, do you need help with your homework? So there's so many different resources out there to tap into.
Right. And Caitlin, similarly, then thinking community wide, we know that a large segment of our community have mental health challenges.
Right.
And we know that for adults, for children. And tell us about some of the resources. We know counseling is important for many people, but there are other resources that I might make use of individually or can benefit from different organizations or groups or options. If you could tell us about some of those.
Yeah, and I think a lot of that for the community, I would say resources that you're looking at, of course, yes, individual therapy, counseling, if you're seeing those concerns, but sometimes people just aren't willing to do that or aren't there yet. Or I think Rita had mentioned earlier, there's just this big stigma around what if I admit there's something wrong with me? What will people say? Even though that something is wrong with a lot of people most of the time, right? Especially something that someone's had something happen to them. But yeah, I think the biggest supportive factor and protective factor for mental health and suicide is connection. So you're looking, I think for community, if we're not willing to do therapy or group therapy, I'm looking for social support, family groups, exercise groups, something that you can do with others so that you can connect. So I know that's a pretty wide net, Risa, but I think that's probably the biggest thing. And some of the things Rita talked about definitely fall in that big net, but having a community group. And the one thing I will say, and I think I say it frequently in these, but for children, the one biggest protective factor they can have is an adult person that cares about them that is not their guardian. That is the number one biggest protective factor for kids. When I talk to people that are adults that talk about when they were in high school, maybe I barely survived. I thought about killing myself every day. Sometimes they tell me they didn't have that person. And that's hard to hear because as an adult, because I'm like, oh my gosh, you didn't have a teacher, you didn't have
So
a
we're talking
coach.
about a teacher, a guidance counselor, a coach,
Right.
some maybe in my faith community,
Right.
if I'm part of one, somebody that I
Right.
can.
And so as adults, that's what we should be looking for is for kids is this kid have somebody? And if not, how can I be that somebody for this kid? Because that kid needs somebody. Because that's the biggest protective factor with suicide for kids. Because children, of course, can be more impulsive than adults. Not that adults aren't impulsive, but that's the number 3 cause of death for children. So and that kind of scares us, right? Because when we think of children deaths, we think of cancer, we think of accidents like cars. Yes, but suicide is a major risk factor for children.
So we want to be attentive, and there's a
Yeah.
question that really somebody is thanking us for the webinar and how important, and a spouse who is not a veteran had a suicide attempt, had excellent inpatient rehab for 2 months. And this person is saying that they had recognized the depression and the isolation, substance abuse in their spouse, and had recommended counseling, but there was resistance to it. But the person did make a call to 988, and we will talk about that hotline. And it's because of that call that the attempt was survived, and now
Great.
in counseling, making use of 12 steps, and things are much better and a long road ahead. But still that question of, other than myself saying, I think you could benefit from counseling, and themselves going to counseling, what can we do? I mean, there are times when, I mean, I can't physically pick this person up and take them. And so Rita, I know you work with people who must call you in distress about, my loved one is a vet and I don't know what to do. And how do you help guide them?
And so of course it depends situation to situation. The one big thing is of course we really push the mental health first aid, assist training, all of those, because the biggest thing sometimes is we don't know what to say. Like so finally somebody, if you ask them and they're like, well, no, I'm not okay. And then a lot of people are like, oh God, what do I do next? And so that's where we try and work on teaching them what to say, what to do. And that's why too, like 988 is great, because you don't have to be the person in crisis to call. You could be the person who's dealing with the crisis and go, okay, I don't know what to do. Please help me walk through this. Because so many times people just don't know what to say. And sometimes they're too close to the situation. They're not the person to handle the situation. And so that's when you tag team somebody in
So
that might be
I
better.
can call 988 and say, I am concerned about my spouse, my child, and really when we talk about 988, that's literally you just dial 988, and that is a hotline. And is it accurate that if you're calling about or yourself a veteran, there's a particular line for?
Yes. Yeah. So you would hit option 1 for veterans. The other nice thing is people don't realize this, but both 911 and 988, you can text message too. So maybe you don't want the person to know you're making the phone call. You can just be texting away and get the information you need while you're trying to diffuse the situation.
Okay, so Caitlin, talk to us a little bit about, there's a part of me that says, how do I know who to call?
Yeah.
988 is specifically for mental health concerns, crisis, but we also know that 911, in my mind, is like an immediate reaction and response.
Right.
But I also know that sometimes people have a concern if it's a mental health issue rather than a physical. So talk to us about when we call who and how, and what we should say or text or.
Yeah. So,
and I know there's no perfect answer.
Sure. No, it's okay. So 988 to me it's a mental health emergency. It's urgent. This person has said, I want to die. I want to kill myself. I'm thinking about XYZ way to do it. That all feels like 988 to me. The great thing about 988 is the person that answers that is a trained mental health person. And they are going to move it up the ladder as they need to. So I worked for an organization like that. The person that answered it would get the therapist when they really needed them, or they would bring the person into a center and say like, hey, will you come in? 911 is when the situation is urgent. Someone is trying to kill themselves right now in front of you. You are immediately concerned that they are holding a gun, for example, and that kind of thing. That would be, I need someone to respond now. That person is going to be a police officer. So that is okay. They are all mental health trained to help you. They will walk you through that on the phone. They're not going to come in the way that you see on TV sometimes with cops. I know we have that visual of officers, but I've worked with them for a long time. That is not what you get in a mental health crisis. They're not coming in like someone's causing a major issue, right? It's totally different. So they will help that situation. You just have to decide, which is really hard when you're not used to, and you love the person. That's usually the situation you're in. You love the person, which one is which? The nice thing about 988, and I tell people this all the time, is you're not bothering them, because sometimes people will think like, oh, well, I think about dying every day, but I'm not going to actually do it because I love my son. So I'm just not going to say anything. You're not bothering them. You can easily text them and say, like, this is always how it's going. What do I do? And they will give you some help. They will listen, and sometimes supportive listening is really what we need. And that's the other thing I would add to what Rita said is if you don't know what to do, being there is an action, right? I mean, there's something you say, Risa, about that all the time. Like being there is an action.
Being present is an intervention.
Being present is an intervention. It's my favorite. Yeah. Being you and being present in the situation is okay. And I don't know if you all are like me, but I have a tendency to answer my own questions. So especially when I'm working with someone who's introverted or quiet, I have to count sometimes because it takes people 15 seconds to hear a question and respond to it. I'm a little reactive sometimes, so I get excited. Like I'm like, oh, I asked them that question. Why aren't they answering me? Well, they're sad, so it takes someone normally 15 seconds to answer, but now they need 30 to process what you said. Give them the time. Just sit there. If they're not an immediate
Right.
concern, yeah, being
So
present is an intervention. I love it.
I want to think a little bit more about the 988 and the 911. So calling 988, number one, there's not a charge associated. I'm not going to
Right.
get a bill for calling. And if I call 988, and as you said, they are talking, they're sort of processing, will they in certain situations say, you need to call 911, or will they contact 911? I mean, will they help make that determination that there is an active crisis that we need intervention for?
Yes. And I say that not to hesitate you towards saying something when you're in crisis, because I think a lot of times people hear, yes, they will call if I say certain things, and then they're like, ooh, I don't want to reach out. The person on the other end of 988, from having worked it, their goal is to help you in the most rehabilitative spot for you, which does not usually mean the hospital. That's not where they're going to send you first. They're going to try to get you help where you need it. So a lot of times people get really worried. My rights are going to get taken away. They're going to pull me to the hospital. I won't be able to go to work. That's like the only thing I've got going for me. That happens a lot when you're in that depression, stress, suicidal spiral. That's not how the process goes. There are usually many, many, many steps before you get to anywhere near the hospital. So just because you say, I want to die, I feel suicidal, and to be honest, I think that is a very normal human experience. I don't know if we've said that yet, but having moments where you don't feel happy, where you feel really depressed because of something that happened to you or not, is a normal human experience. So if we hospitalized everyone who said they wanted to die from time to time, everybody'd be in the hospital. So that's just a normal human experience. Asking for help for a normal human experience is normal.
So then it makes me think, Rita, about the concept, which might be new to many people. I know it's something I'm learning about, which is the mental health first aid concept. So first aid, I think about medical emergency. I think about somebody is bleeding. I think about they might be having trouble breathing, they're choking. And I have some concept of what to do in that space. And so tell us about mental health first aid. I'm imagining it is a similar concept and trying to take away that stigma and putting it on a level playing field. Medical and mental health are just as important and things that we should step towards.
Yes. And that's the thing too with mental health first aid. It's like, just like you said, it's almost the same thing as regular first aid. Um, you're trying to assess the situation, figure out what to say and do. You know, do you need a band-aid? Do you need a tourniquet? It's the same thing. Do you need to just have a conversation? Do we need to get you to a professional? And that's what mental health first aid teaches you. It's how to assess the situation.
I got it. I'm a mental health
Okay.
trainer too. Yeah, it's how to assess the situation and then what to do next. And the really nice thing about that, like a lot of times you think you might not need that because it's just talking, but it really isn't. It's actually a little scarier sometimes, right? Because when someone isn't breathing, there's an obvious way to check for that. But we're looking for something that's a little more subjective sometimes. And that's why we talk a lot about risk factors, about signs and symptoms, and being a present person for people and noticing things. You know, we notice things a lot. You see that, like you'll talk to somebody and you'll be like, wow, that is really different for them. What is going on? And instead you're like, gosh, that's annoying to me, you know? But what if we as people were just like, this is not usual you. What's going on? Can I help you?
So I think, Rita, I think about with first aid, if I step in and I use a tourniquet instead of a band-aid, I think most people are going to thank me that I tried my best and I did, there is this sense of the Good Samaritan, but somehow mental health has that stigma attached to it. And I wonder, and I think even perhaps, more so, or particularly within the veteran community of asking for help or even suggesting, and how do we address that? Or maybe it's just acknowledging it.
The big thing is breaking down the stigma. So one of the things that I constantly work on doing is just have the conversation with people, letting them know it's okay to talk to each other. You know, we have a mental health summit here in the county because we want people to know like it's okay. I would never tell somebody to get over their cancer. Why would I tell them to get over their PTSD? And it's making people understand like if you're in the hospital because of a mental health crisis, I would do the same thing for you that I would for somebody who is in the hospital for a physical illness. In the South, we like to bake casseroles. Still bring them that casserole because they might not have the energy to go ahead and cook. They might need that supportive thing. And then it just opens up that door for that conversation because they're like, okay, this person cares enough. They want to make sure I'm eating okay. Let me go ahead and have that conversation with them. So the biggest thing is talking to each other. I know like in the veteran world, we try to talk to each other and sometimes it's hard. You kind of got to assess the situation based on the veteran and what they're willing to talk about. But even at home, with my 16-year-old, it's keeping an open, flowing conversation. She has no problem telling me how she's feeling, what's going on, because we have those conversations. And sometimes not to equate children and veterans together, but like the two of them kind of need you to draw it out of them a little bit more than the average adult who's maybe seen different things in a different line, where veterans and children were kind of, with our kids, we're kind of like, oh, you don't have anything to be sad about. You're a teenager and that life is good. Sometimes we do that with military. We're like, oh, well, you're in base housing and you've got food and you've got this. So you're kind of pushing it off. You don't want to do that. You want to let both groups know how important it is to carry on those conversations. And if they talk to you about it's okay because you might be what they need is just to get it out there. I know sometimes for me, I'm like, let me say what I got to say, and then I'm going to go do what I got to do next. And sometimes that's all they need. So that's why, like what you're saying, opening those conversations and then breaking down that stigma and exactly what you said of like, I would rather you be a little mad at me because I got you help because that means you're alive to be mad at me.
And
Well,
I think something that's very interesting about what Rita said, that we haven't mentioned or I haven't highlighted is I think veterans are very action oriented. They like to observe your behaviors and see if you mean what you say. And, lots of people are like that too. But I think about a veteran, of course, recently said this to me, like, I know you care about me because you made me lunch, which I hate to do. So that's the non-Southern in me, probably Rita, but and brought it to my house. Yes. I do care about you. And that is a very clear way for me to show it. So yeah, I do think there's something about your words matching your actions that show veterans and others, of course, that you care. And when it's consistent like that, that opens that door for, I do care about you and I'm also observing this thing. How can I help?
So I also have a thought, Rita, and this I think is a belief perhaps in the community, maybe as a healthcare professional or a mental health professional, that I have to already be sort of in the VA system in order to make use of any resources. And for mental health, that is not the case, right? You can be my first stop and I don't have to already be connected, or what does it take for me to be able to make use of the services?
Yeah, so the mental health side of the VA is a little bit different than everything else.
Okay.
So as long as you have your DD 214, you
Which
can go
is
your discharge paperwork. If you're a veteran, you know what that document is. um, but as long as you have that, you can go to the vet center or the VA for mental health services, regardless of the type of discharge you have.
okay.
We still recommend you coming to see us so we can go ahead and start that process on a different side. But you do have that option, regardless, that you can go and receive at least basic mental health resources until they get you to a permanent fix.
And if I am the spouse or family member, I can do the same thing. I can come to you. I can enter that system with a mental health concern.
Yes, it's a little bit different for spouses and children. There's different avenues we would need to take, but we can still point you in the right direction for those.
So basically, you're being our navigator.
Yes.
And so, Caitlin, I'm thinking we have talked some about. I am worried. I'm thinking about the question we had earlier, and somebody who was saying, "What more could I have done?" And I'm thinking about the more I am educated, thinking about that mental health first aid. Are there places I can go and learn about that? I can become
Yeah.
trained.
Yeah, absolutely. I think some of what we're talking about today is helpful, but also, yes, mental health first aid, of course, is, a recommendation I think Rita and I would both have. And there's many courses around the state. You can go to their website and look for one, or message Rita and I or through the thing and let us know if you're interested. But yes, that really helps teach you what you can do for people that are sad, anxious, depressed, whatever, experienced a trauma, getting a major life transition like leaving the military, moving, divorce, any of those big, big things, right? But also, some of the things I said earlier when people are saying some of those things that matters, and then looking for, those risk factors like prior attempts, a serious mental health disorder, increased substance use. I think the things that the person who asked the question earlier highlighted, she noticed some of these things, maybe from her own experience in the past or from a training. And it does sound like she gave information and did all the right things. And that's what we do as people. We want to give information. If a person knows I can reach out to 988 when I'm in a serious moment, that's all helpful information for that individual. So yeah, I think that's what we do to show up. And so, yes, I think going to mental health first aid, of course, is a great first action. But some of those, looking for some of those signs and symptoms, and like I said, being present and asking people if they're okay is a big step. Or even, and this is something for mental health first aid, are you thinking about killing yourself? Like, that's a question that feels really hard to come out of your mouth, but it is concerning, right? And we think about it, if we interact with someone, a family member, a friend, whoever, and we start thinking, gosh, I'm just worried they're thinking about killing themselves. Don't you lay down your head at night and think about it? Why don't you just ask them?
I think my fear, or what I hear from so many people is if I ask, okay, they might think about it or make it happen. And we have already said that's not the case.
Right.
But what if they say yes? What do I
Yeah.
do?
Yeah,
I'm
absolutely.
general person. What do I do if this person I care so deeply about
Yeah.
says yes? I think that's also sort of paralyzing, and
Right.
avoiding it isn't going to help. But I think many of us, especially with mental health issues, we do avoid.
Yeah, and one thing I will say about that, the interesting thing about protective factors for suicide, absolutely getting good access to care and effective mental health care is one of the top, 5 that we see. But the others, all the others that we see that are protective factors have nothing to do with the mental health system. They're all about what you've got going on in your community and your sphere of friends and family and connection. So that's a big point that I would say. And how lucky, I think some of that is reframing it. How lucky are you that that person cared enough to answer and tell you the truth, which is, I have to say, one of the best signs that someone's willing to get help is to admit it. So that's a great thing. If you're in that situation and you say, "Are you thinking of killing yourself?" The person says yes, then you're in the perfect situation to be there and to listen and connect them to the right people that they need.
And that
So
might be picking up the phone and calling 988
that's right.
in that moment.
Yeah.
And I'm also thinking about, we've talked, Rita, about a number of resources through the VA, but I'm also thinking, Caitlin, about other resources for those who might have chronic mental health issues or substance use issues, or there are organizations, again, trying to be proactive that we may become connected with.
Right. And there are numerous counseling crisis centers in Guilford and Alamance and many of the other counties in North Carolina. And that is definitely something, if you're not sure what your closest crisis center is, 988 can definitely help you with that. It's surprising how easy it is to text them and get that information. But yes, there are many crisis centers that are walk-in 24/7. There is also in Guilford, a new behavioral health crisis that goes to your place, your living place, and can talk to people, can assess with a mental health clinician. Sometimes an officer will go. It just depends what you need. But yes, there are many walk-in, stop-in crisis centers where you can talk to someone. And from working at one for many years, I hospitalized less than 1% of the people that walked in. That's not the goal. The goal is to help people with what they're going through. And I think that's what people's biggest worry is about admitting that they want to die. They think something horrible is going to happen to them as a result, or I think Rita mentioned this earlier, they're going to lose their benefits. They're going to get discharged from the military. They're going to lose their job. That is not typically what we see happen when people reach out for care.
So to be clear, Rita, from a veteran standpoint, having a mental health diagnosis is not going to negatively impact my benefits or negatively impact my experience. Is that accurate for us to say?
Yeah, there is no reason why that diagnosis should be harming the veteran in any way, shape, or form. Of course, there's things that, veterans have to take, well, anybody has to take into consideration. So if you have had a suicide attempt, or, you are a harm to yourself or others, there are things to consider. The Brady Bill will go ahead and you will have to, anything that you could use to hurt yourself, you're going to have to give up. But that's not the typical case we see. Usually it's that the veteran is reaching out because they need support and they need help. Um, I know, like, a lot of people worry, like, the one thing I hear a lot from my veterans is if I admit I have PTSD, they're going to take my guns. And a lot of our veterans are hunters. Like, that's something that they are using to get through their mental health crisis. So it's trying to toe that fine line and explain to them, like, no, unless we're having an immediate crisis, like, it's okay to be sad. It's okay to have anxiety, and navigating that process with them, but it's not going to stop them from getting monthly compensation. It's not going to stop them from getting health care. If anything, hopefully it's going to get them more of the supportive care that they need.
Yeah, it would be unusual to have your gun taken away unless you were hospitalized against your will. That would be unusual. And so what I would say about that, and what I've said to veterans a lot, is asking for help is a great way to not have that happen, which I think is a big concern, because I understand, if you've been in the military, or if you're the type of person that's just grown up around guns and like it's always been one of your activities or your leisure or hunting, it makes sense that that would be a major concern for you, that this lifestyle thing would majorly change. That's not typically something I see with mental health conditions, or even admitting that you have moments where you feel like you want to die. That is never the first step that we see. So
Right.
getting help and asking for help would actually prevent that from happening.
And a lot of what we're talking about, I mean, whether it's becoming connected with a group that has others that have anxiety disorders, or others who may be dealing with another particular diagnosis, or all of those things, again, are the proactive, I'm being in a supportive community.
Right.
Others, whether they're peers, trained professionals, are giving me information and resources. I also want to be clear that, while we are wanting to support people's autonomy and making choices, and there are times when we step in because we are worried about not only the safety of that person, but safety of those that might be around. And so harm to self and harm to others, Caitlin. I mean, we want to be, there are times when we have to be proactive and we have to step in.
Right. And I think what can happen sometimes is we care about someone so much, we want to respect their wishes. But I think that's exactly what you're talking about, is if you have an immediate concern, if you're talking to someone and they're like, no, I will not go talk to someone. No, I will not talk to you about it. No, I do.
How are you?
Hurt someone and or hurt someone else. I think those are the times when we need to act. We need to get someone that specializes in that, because not taking action is a major inaction, and that's not okay.
Right. And I'm thinking about you made a comment about somebody who may be, oftentimes people are thoughtful, but if we're in a space of being reactionary, maybe we're under the influence of a substance. I mean, there are times, and we should not feel bad about that. We should not apologize, but we should also identify to 911 or 988 what is occurring. Is that correct? I mean,
Yes, for sure.
Happening.
Yeah, I think you want to tell them what's happening, information that this person has had this happen to them. They were in a war situation and had multiple things go on. Whatever information you can give to 911 is given to the officers that respond. Typically, if you can give information that it's a mental health crisis, they will send officers that have mental health experience to that site, of course, because those are the right people. The other thing I would say, that just from a data standpoint, is the majority of the things that we see on the news, where something really awful happens, those are individuals that are not getting mental health care. And so very frequently when we see one of these big incidents happen or something awful happen where there's either multiple deaths or someone hurts themselves or someone else, those individuals are not under the care of a mental health provider. And what is concerning there, and why we're trying to do this and why we're talking about it, is a lot of times we look back and we see, oh, here were all these things, and I was worried and I didn't say anything, or I was worried they wouldn't want the help, or gosh, I didn't think it was that bad. But what if we helped the person before it got to that point? So I think that's why mental health first aid exists, and that's why I think Rita and I are having this conversation today. Is a lot of times we let our brains say, oh, it's okay.
Well, and we think to that worst case scenario that we see. And Rita, there's a comment about someone's husband who's a vet with severe illness and PTSD being able to go through community care, getting couples counseling, and really being able to find wonderful counseling. So affirming the fact, I think that, again, seeking out, and sometimes I think it's that first step. And I'm realizing that we're coming towards the end of our time. And so Rita, if you were to say to, I know you're in Randolph County here in North Carolina, but for any veteran, any family member, what's your takeaway in terms of, I think about, like just doing it, somehow bringing myself to make that first contact, or sort of what's your takeaway for us?
Yeah, that's the thing too, is go ahead and find out, because the worst that somebody can say is no. But go ahead and reach out to your local VSO, your local VA. I know sometimes a lot of our veterans get discouraged because the VA doesn't explain things.
Yeah.
A lot of times veterans hear when they go and apply for medical, no, you make too much. That just means we need to find a different avenue in. And that's why I always recommend talking to the VSO, because there's different avenues into the VA and getting that supportive care. Like the question just said, sometimes it's not using the resource through the VA, it's using a resource through community care. I see community care for my mental health because I did not want to go to the VA for mental health care. Up until very recently, the healthcare center we had here had no females to talk to. Well, I'm not going to go talk to a man because they're not going to understand where I'm coming from. So just go. Like, the worst they're going to say is, no, we don't have that resource. Let's go this way and stay. But like I said, just know that no isn't always, I always, to me, the word no just means no, not for now. Like, there's another way to do this. So if they say no, it's just, you've got to find another avenue. But definitely go ahead and take that first step. A lot of times with veterans, like, this is your earned benefit. Think about when you were a little E1, when you first got in there, how much money you didn't make. And it's because they put this money aside for these resources after service. But this is something you've earned. This isn't a handout. This isn't,
Right.
this is something that you are entitled to based on your service. So definitely go and use the resources. They're there for a reason.
Right. It's something we're honored to provide. Like, I think that's where we kind of have trouble, where we think other people maybe need it more, or other thing, I'm not that bad. Oh, I should be happy because I have all these things. My friend's son died, but mine didn't, so I should just get over it. We as humans do a great job of explaining those things to ourselves, but actually, if you need help, if you're on that path and you're having a hard time,
Sure, I
whether
appreciate
you're
that.
feeling suicidal or not, you should reach out and get help. And sometimes, as responders or helpers, we need to be open to it. Someone came in here earlier to ask for therapy services, and that's not usually how we do things, but she walked in. Of course, we'll take your information. We will help you. This was how you made an action today to get help. Love it. And that's
So-
how we have to be open. Yeah, sorry.
So Caitlin, as we wrap up, I want to just hear your thoughts and maybe affirmation and giving grace for those who we try to get help for those that we love. We try and we cannot always succeed. And sometimes the outcome is not what we would hope for. And
Yeah.
so in terms of recognizing that I, as a caregiver, care person, cannot always
Fix it.
fix it.
Yeah. Yeah. And I run the suicide loss support group here at AuthoriCare, and I absolutely believe that. It's just something that I truly believe. It doesn't mean that there aren't some signs and symptoms of suicide, but your person may not have presented them to you. And they may not have presented them to many people, or really anybody that was able to see it. And I do believe that depression, substance use, bipolar disorder, many of these things can be a terminal illness, and that can lead to death by suicide. So while, we're here talking through, here's how to help prevent it, here's some things, getting community support, having groups to go to, all these ideas that we have, and having great access to mental health care, some people don't see that they have that. And so that's why we're talking about some of these things today. But absolutely, Risa, I agree. For some people, those mental health diagnoses, PTSD, all of those can be a terminal illness. And just because you love someone who died by suicide, which most of us love someone that died by suicide, it is a very, unfortunately, common thing. I think there were 50,000 suicide deaths last year. So we want to give ourselves some grace in saying, sure, there may have been some signs and symptoms. Maybe they did not present them to me. Maybe I tried absolutely everything I could and I was prolonging too. I want to believe people can do well and get better. We all do. But yes, I think it can, those mental health diagnoses can be, those substance use diagnoses can be, yeah, a fatal diagnosis for
Well,
some individuals.
I want to say thank you. I want to say thank you to Caitlin and to Rita for this conversation, for the work you do every day. I want to thank the participants for joining us, being part of this conversation. There'll be a follow-up email tomorrow with access to the recording. Please share it with others. It will have links to resources that we talked about. And I want to draw your attention to next month on October 23rd at noon. We'll be having two AuthoriCare staff members talking to us about when is hospice the right choice. We know that having the knowledge really is power. And so we're going to talk about when is the right time for hospice. We hope that you will register, join us for that conversation. And as we close today, I want to share a quote from Glenn Close. And she says, "What mental health needs is more sunlight, more candor, and more unashamed conversation." And I think that's what we did today. And I hope that we can all continue to do that. So thank you all for joining us. And I hope that it is a safe rest of the day. Thank you.
Thanks.